Have you ever imagined what would happen if you were to be short of breath for about a minute? And what if it goes on for a few more days? It can be frustrating, isn't it? A 70-year-old female patient, Mrs. J. van Niekerk, is brought into the emergency unit. She is complaining of shortness of breath, which has been going on for several days now. She's been reluctant to come to hospital, hoping that the symptoms would resolve very soon. But unfortunately, that was not the case. Actually, it was getting worse day by day. Hi, you are watching ED Files, and I am Dr. Thabo Mafa. Shortness of breath could be as a result of different conditions a patient might have. It could be lung infection or inflammation of the airways. It could be a cardiac problem, or it could be renal failure or kidney failure that results in accumulation of fluids within the lung tissues. However, in the case of Mrs. J. van Niekerk, she's got pneumonia. And what is it? This is infection of the lung tissue that involves the alveolar space. This is where gas exchange happens. You are supposed to inhale oxygen amongst other gases and exhale more of carbon dioxide. But in the case of a pneumonia, because there is lung infection and the alveolar level as well, gas exchange is not adequate. And that would explain why a patient would present with shortness of breath. Shortness of breath can be seen in various conditions. However, in a case of pneumonia, it tends to be very, very classical. What are the risk factors for pneumonia? One of them is extremes of age. A very young patient or an elderly patient, usually above the age of 65. However, we still see these cases in middle-aged patients, a 30-year-old, 40-year-old, depending on what the surrounding circumstances are. Alcohol abuse is one of the things that we see in patients who present with pneumonia. Patients who are on immunosuppressants for organ donation are also predisposed to having this condition. Other immunosuppressive conditions such as HIV and AIDS, patients tend to have lung infections also. What are the possible causes of a pneumonia? You could have bacterial infections such as Haemophilus influenzae, Streptococcus pneumonia, Klebsiella. On the viral causes, you could have coronavirus. You could have adenovirus and rhinovirus or influenza. You could also have fungal infections such as PCP, Pneumocystis jirovecii. You could also have Cryptococcus neoformans. On the parasitic infections, one could have Toxoplasma gondii, which comes from cats. And lastly, you could have tuberculosis or TB causing a pneumonia. Mrs. van Niekerk is a 70-year-old patient. She's an elderly who was taken into hospital for an elective surgical procedure. She was kept in hospital for about 2 days, and thereafter she was discharged. A day later, that is after being discharged from hospital, she started having this heaviness in the chest and also shortness of breath. So now, what are other possible symptoms a patient could have when they've got a lung infection. One of them is shortness of breath. They could also have fever, or they could have a productive cough. Those are some of the symptoms a patient could present with. However, in the elderly patients, you may not have all the classical symptoms. So, how do we investigate a patient with a pneumonia? We've taken bloods to check for infection, inflammation, to also look at the cardiac profile and the kidney profile. So we've done full blood count. And full blood count on it, basically we looked at the white cell count and also hemoglobin, just to make sure the patient is not anemic, and also to check the infection marker itself, which is a white cell count. We also did the CRP, which is a marker for inflammation. We did a cardiac profile, and that is a pro-BNP, to check for congestion within the heart if the patient is not in heart failure. We've done a troponin T, just to make sure the patient doesn't have a heart attack. And we've done a kidney profile also, just to check she doesn't have kidney failure that is resulting in accumulation of fluids within the lung space. We also did a blood gas. And under normal circumstances, you are supposed to have carbon dioxide levels or PCO2 levels that are ranging from 35 to 45. And in her case, her PCO2 levels were very high. It was about 65. She was starting to be acidotic, meaning that she was starting to have acid in her body. So her pH was starting to come down. It's supposed to be between 7.2 to 7.35 under normal circumstances. But hers was starting to go down. So the lower it is, the more acidotic you are. So she was starting to be acidotic, and she was starting to have what you call impending respiratory failure. We've done chest x-rays that concluded she's got a consolidation of the right middle lobe. In a patient who's got all these classical symptoms of lung infection, but the x-rays are not conclusive, you might have to take them in for a CT scan of the chest. And also on that, you'll be able to see nicely and in more detail where the infection is. Secondly, with a CT scan, you can also see the pulmonary vessels, just to see if there's any clots in the lung, what we call pulmonary embolism. In the case of Mrs. van Niekerk, the investigations did suggest that she's got a lung infection, a pneumonia. But for us to know exactly what pneumonia it is, or what bug is causing that, we had to do sputum collection for culture to see what bug is really causing that. We also did respiratory viral swabs to check if it's not influenza. Is it adenovirus? Is it coronavirus? Amongst other things. So, what are the possible complications of a pneumonia? Patient could have respiratory failure, acute respiratory distress syndrome, lung abscess, or a pleural effusion, amongst other things. However, in the case of Mrs. J. van Niekerk, unfortunately, she didn't make it. She succumbed to the disease. So the take-home lesson here is that pneumonia is potentially fatal, especially if it goes untreated on time. So early recognition of the signs and symptoms of pneumonia and commencement of treatment as soon as possible is quite important. And thank you very much for watching.